It's been 1 month since 2 massive earthquakes struck. Now Turkey is facing the daunting task of rebuilding after thousands of apartment blocks were destroyed. Across the country, victims continue recovering from serious injuries, and warnings of secondary diseases are becoming a major issue. I'm Andrea Sankey, and today's Newsmaker is the month after the earthquakes. On February 6th, deadly twin earthquakes struck Türkiye and Syria. Between both countries, more than 50,000 people died. Many are still missing, and well over 100,000 people were injured. As rescue workers pulled people from the rubble, thousands needed treatment for serious injuries. In Syria, the few hospitals available were quickly overwhelmed. While in Türkiye, many hospitals in the region were damaged, making it a mammoth task for aid workers to treat the injured on the ground.
The suffering is impossible to describe in words or even in pictures. Nothing can convey the depth of grief and loss so many people are feeling. The destruction is immense, but so is the response of the Turkish government. During the first 2 weeks, more than 55,000 people needing care were transported to hospitals all over Turkey in any way possible, by helicopter, ambulance, and car.
Turkish President Recep Tayyip Erdogan announced that 214,000 buildings had either collapsed, were on the verge of collapse, or had severe structural damage. And that's led to over 1 million people being housed in temporary shelters. Now doctors are warning of a secondary health risk, saying the challenging circumstances in the worst-hit zones create conditions that could spread contagious diseases and respiratory tract infections.
The disease is caused by contaminated food and water, from cholera to other gastroenteritis, such as diarrhea endemic, are our primary concerns. Additionally, we are in the winter season, known as influenza or flu season, and the COVID-19 epidemic continues in this period. The risk groups, especially those over 65 and those with underlying diseases, are at severe danger. Their vaccination should be administered properly. The implementation of childhood vaccinations, such as measles, diphtheria, pertussis, and tetanus, should have been administered. If we cannot fulfill this, we could soon face epidemics.
Now, arguably the most difficult stage, the rescue phase, has finished. But for some, the hardest work is just beginning. Victims are fighting to rebuild their homes and their lives, as well as heal themselves from massive injuries suffered, both physical and psychological. Here now to discuss this new phase of recovery, I am joined from Gaziantep by Jean-Nicolas Dangelser. He's the Emergency Preparedness Coordinator at Médecins Sans Frontières, and Levent Ozturk is the head of Yardim Konvoyu. From Chicago, we have Dr. Mufaddal Hamadeh. He is the former president of the Syrian American Medical Society and first responder in Syria. And joining me in the studio, Dr. Mazen Kewara. He's the Middle East director of the Syrian American Medical Society. Thanks all so much for being with us. Jean-Nicolas, I'm going to start with you. You have seen so many levels of disaster around the world, both man-made and natural. You were one of the first to arrive with MSF in Türkiye. And like I said, in so many ways, the work is just beginning. So many hospitals and medical facilities were destroyed, and so many people are now in need of care, some long-term care. So what needs to be rebuilt first, and who needs to be treated?
Indeed, the people are really in dire conditions in many places, and the scale of the disaster here is enormous. It's something that we have seen since the beginning, is that so much has to be rebuilt, and help is required in so many places at the same time. It has been impressive since the beginning to see the solidarity of the people. And everything needs to be rebuilt as a priority, because when we are talking about health, obviously the house of the people is a priority, because they need to have proper shelter. They need to receive proper non-food items, especially that it's still cold at night. So blankets, etc. So really, it's not just the people that have been injured, of course, but it's really everybody that has been displaced as well, that require some support, and the needs are still very big for sure.
Right. I mean, with MSF, you, for example, did a lot of work in Haiti. How is this comparing? I mean, you mentioned the solidarity. There is some semblance of infrastructure. For as much as was destroyed, there is a core of what they need to work with to help so many injured people. So give us a comparison, if you can, quickly, between what we're working with in Turkey and Syria versus what you saw in Haiti, for example.
So the recovery is much faster here, because the society and most of the country also managed to mobilize and send some support. I mean, the government, but also the population. The capacity was really impressive in terms of airlifting the wounded into other hospitals of the country. So in that sense, the comparison is hard to make, because uh, here the capacity were much greater to support the affected population. But for sure, what now need to be rebuilt, and the population that need to be supported still have the same needs that we can see somewhere else, when people are displaced and they lost their home and everything inside, and they are affected also psychologically. First of all, the support in terms of mental health and psychosocial support is immense, because this disaster, that scale is rarely seen, and losing so many lives in the matter of a few seconds,
Right.
it's something very hard to recover, definitely.
Indeed. I mean, the scale, we keep repeating it, but it's it really is incomprehensible still, 1 month later. Levent, let me ask you, though, as a Turk yourself, and hearing what Jean-Nicolas had to say, I mean, how are you feeling about the solidarity you've seen demonstrated in this past month? And what kind of difference has it made to helping people recover in the last 4 weeks? And what do you think it'll do going forward?
It's really hoping the people all around the country coming to support, and also international community are here coordinating with the government and try to support all of the effort to people rebuild their lives. As a person, I see in 1999 earthquake, in Marmara earthquake, the scale is much bigger than that one.
Yeah.
And the people now, like Nicolas said, try to rebuild their life, because some of the places like Hat and Antakya, there is nothing left. So at this scale, rebuilding their lives is much difficult. Why? Because mentally also many people have a big depressing, because many families at least lost their one of the relatives, and this time in this big scale of disaster, we're also facing another thing. It's emotional and psychological effect on the ground. But we have one advance in Turkey. We are uniting all the time after we face some kind of disaster, supporting each other in Turkey. So now all of the other cities sending their all relief items, and whatever they can do, they're trying to do to support the victim of earthquake. This is now we have at least as a hope for their future, but it's take too much time to be rebuilt again.
Yeah. You know, Dr. Hamadeh, we've heard a lot of talk about the psychological support that's going to be needed, but we've constantly been mentioning hundreds of thousands of injured people. Tell us a little bit more about what kind of injuries we're actually looking at and how they need to be addressed. Will new planning need to be made specifically for the people that are now left with some serious physical disabilities?
Thank you very much. I think all the points that were mentioned are extremely valid. I just want to mention one thing very quick, is there is a little bit of difference between what in Turkey and in Syria. Turkey is blessed with a great infrastructure, great support system. Syria has been, that part of Syria, south and northwest, has been under siege for many years, under war. The infrastructure, healthcare infrastructure, is very stressed, and the abilities to recovery are much, much more limited. So that really compounds a problem. One more thing to mention also is the fact that many of the displaced in this earthquake, whether Syrian people in Turkey or Syrian people in Syria, has been displaced 2 or 3 times already. So that adds so much stress on the population. So what does need to be addressed in terms of injuries? Physical injuries, you can see a lot of, what we see the most is crushed injuries. Many of these injuries will lead to amputations a lot of times, and will require a lot of reconstruction after that. There will some expertise that are not available in Syria to perform such complex surgeries like vascular surgery, neurological surgeries that were required for crushed spines. I think the other, aspect is obviously the psychological injury, psychological damage that we can see. Remember, for each victim who survived, he left behind sometimes entire family. So there will be a lot of financial, emotional support that is going to be needed to really accommodate those survivors. Many children are left alone. They're basically lost their entire families, their parents. That would lead to a risk of child exploitation down the line, child abuse. We need a comprehensive plan for protection of children for the victims of this earthquake. We need a lot of rehabilitation for many of those injured limbs, physically injured souls, and actually physical injuries that are going to require long-term rehabilitation.
Right. I'll tell you what, we've just been joined, actually, and I'm going to introduce our fifth panelist, Oren Rosner. He's with the Israeli Search and Rescue Team. He's just joining us now from Tel Aviv. Oren, thanks for being with us. I'm going to come to you in just a second because I wanted to address Dr. Kewara first, off the back of your colleague there in Chicago, to talk a little bit more about the specific issues dealing with Syria right now. And another interesting angle that the doctor in Chicago just mentioned is the fact that so many kids are not just left vulnerable to the psychological issues of recovering from this earthquake, but they're still vulnerable to the issues of war and the fact that some lawlessness in the area leaves them vulnerable to trafficking and other, horrible, the criminality that comes with the lack of the instability that we're seeing in Syria. Tell us what you've had to witness in recovering, especially with children in this picture, post-earthquake and with the war ongoing.
Yeah, 12 years of war, then the earthquake came and made their life is very, very, very difficult and very challenging. We have in this area more than 4.5 million people. Half of them are displaced already. 1.5 million are living in camps. So they are vulnerable to all kinds of challenges and abuses and different lack of essential needs. So now, unfortunately, this poor infrastructure for governance, health, the economics, very poor economic situation, make things more difficult in their physical well-being or psychological well-being. Physical well-being, we can talk for weeks about the needs for rehabilitation in years to come. Psychological wise, we have very poor infrastructure for psychological services in Syria since long time. It was before the war. So now when we don't have more than 2 psychiatrists in all this area. So that means we are lacking the essential needs for psychological recovery for those children.
And we just need to point out, when you're talking about psychological recovery, it's not just about those individuals that need that help. This compounds and causes generational disorders when you have no treatment, no help for people in need of that psychological assistance. It carries on for decades.
Exactly. This is what we are afraid from, to have this community not to be recovered psychologically if it will be at some point had permanent solution for this long-term crisis. So this is what we need to draw your attention and the international community attention to the need of psychological services in this area, and for a long time. We are lacking the enough capacity to do so. SAMS is doing what's needed. The humanitarian partners do what in their capacity, but we need the world, the all international community to take care of that for years to come.
Right. I mean, everyone can ultimately pay the price for psychological destabilization of a traumatized area. It feeds into the rest of the country and it goes beyond borders. Let me bring Oren into the conversation now. Oren, I'm glad you could join us there from Tel Aviv. I mean, you were one of the first on the ground when the quakes hit. You've seen so many astonishing images in your work. First of all, I'd actually like to ask you what the most kind of the emotional takeaways, if I can phrase it like that you had from seeing this disaster. With all of your experience, this disaster has been unique in the size of it and the fact that you did have to leave after a few weeks. And I imagine you'd almost like to get back as soon as possible to continue to help because you understand how much help is still needed after what you saw.
Yes, so our delegation, the Research and Rescue delegation from Israel, we arrived very fast to Turkey, where most of the units are reserved. So we leave our works and fly to Turkey when we heard about the disaster. I think the moment that is I remember the most, it was the rescue of a father and daughter from a building. Me and another team member worked about 6 hours to get them out from one of the buildings. Me personally, I was inside the building all the time. I'm search and rescue engineer, and the rescue was very complicated, so I needed to be there from the beginning to the end of the rescue. And to be there with people in this moment, it's really, really hard for us as rescuers to see the pain after so many days of staying underground the gravels. But the moment after bringing them out, it's like feel like a joy of a birth a baby. So the father is Muhammad, 39 years old, and his daughter Romaisa, 14 years old. The day after, my team also the son, Rudban, from the same apartment. So I think this is the moment I remember the most.
And I mean, and that's the ironic, I've said this before, but I'll repeat it. That is the ironic beauty of these tragedies, is that you do end up seeing really the best of humanity and watching people risk their lives to save total strangers, to end up seeing what you were able to see and feel, you know, that emotional connection to people you've never even met, but knowing that they will have a life because you risked your life, and all these rescue workers, all of the people on this panel even coming to do this work so selflessly. But now as we're moving forward, as we were saying, Oren, you missed it, I mean, we're talking now about the really hard work that's actually just starting. Let me go back to our panelists in Gaziantep there. I mean, Jean-Nicolas, please tell us about what everything that's really needed, from the equipment and the supplies needed to assist the injured, those disabled people we talked about, the people in need of psychological care. Send your message out now as to what needs to be done. It's not just those volunteers we want flooding in the first few weeks. We're going to need help for years going forward. What does the world need to know about what assistance still has to come?
I mean, for sure, as you said, it was amazing to see all the volunteers coming at the beginning. But what we also see is some instability in that system, because we have people coming for a few days or for a few weeks at most, and the recovery in terms of also mental health and psychosocial social support, it's something that is done also through the relation between the therapist and the patient, and that requires people that stay for longer time, and as you rightfully mentioned, resources that would be needed for months to come, for years to come. And so a huge mobilization will have to be done in Turkey and in northwest Syria for sure, in order to address those needs on a longer term. And so we are now seeing some tense city moving into container city. We still see some people that are on the fringe of that, and the rural area that are also most affected. What we need to create for people, and this is very important, and especially for women and children, some safe space where they can have a mental break of what's happening, that we can actually talk to them, and that they can rest a little bit in the middle of the chaos they have lived, and that gap that all those loved ones are death.
Okay, we've just got a few minutes left. Dr. Hamadeh and Dr. Kewara, I want to come to you as the medical doctor to yourself, because there's another issue at play here. We've got so many millions of tons now of rubble. And they've been talking about the kind of, potential respiratory illnesses that people could suffer, and other illnesses, these contagious illnesses that can take place when so many people have to live in tent camps together. Give us an idea of what we're really talking about here and how that needs to be addressed.
Well, I mean, talking about Syria in particular, I mean, there is a huge lack of infrastructure, health infrastructure that needs to be rebuilt and needs to be readdressed. We, as SAMS, have been working 10 years to build some infrastructure, but it's not adequate. But it did do a good job in saving many lives. And I think going forward, we need to restart building the healthcare infrastructure in Syria.
Right.
Obviously, the same.
Because what will the actual patients be facing?
Well, I mean, respiratory illness is a huge thing there, especially with a lot of dust, a lot of debris. Smoking is very pervasive. Living in tents where people smoke also can leave children vulnerable to asthma and upper respiratory illnesses. That is going to be very difficult to handle. Also, the fact is many of these patients now who are displaced don't have access to their medications, don't have access to dialysis, have access to cancer treatments that they used to get. So there will be a lot of health problems compound down the line because of this problem, not able to access healthcare facilities, doctors, and clinics.
Exactly. Let me just get a final word from Dr. Kewara, having heard that. I mean, what are the challenges that you fear the most about patients getting the treatment they need?
Yeah, I think we consumed our reserve from the medical supplies and medications because of this, surprise and very, very bad earthquake crisis. So we need to restore our reserve from the medical supplies and medications. We need to rehabilitate our infrastructure, our equipments destroyed in our facilities, some of our facilities, which it's evacuated already because of the earthquake. So all of that is needed when we are talking about the dialysis and the crash syndrome, which we are facing every day with a huge number of patients in the ICU units. So we need dialysis kits. We need the international community, the humanitarian community to take care of those things, because those things is very urgent right now. We don't have enough number of ambulances, for example. So all of that is needed right now. Maybe on the long term, we need to look at rebuilding the healthcare system. We need to look at the rehabilitation and the psychological rehabilitation services for those people.
Dr. Kewara, that will have to be the final word. I'd like to thank all 5 of my panelists really so much for being with us on this edition of The Newsmakers. Our viewers, of course, for tuning in as well. Remember, you can follow us on Twitter. Do be sure to subscribe to our YouTube channel. I'm Andrea Sankey. We will see you next time.